Hello, everyone. I want to welcome you to our Google Hangout, our virtual book club chat. We're very excited to have you all join us. My name is Sherry Levinsky-Raskin. I am the Professional Development Chair for the Education Committee of the American Alliance of Museums, as well as the Assistant Vice President for Education and Evaluation at the Intrepid Sea, Air, and Space Museum. And I am delighted to be joined by my colleagues today who are going to be presenting. I will be introducing them shortly, as well as all of you. So thank you all for taking the time. This is a very exciting topic. We're going to be focusing on enhancing the health and wellness of our visitors at our institutions. And this is going to be exploring specifically the most recent issue of the Journal of Museum Education, which I think this is going to be a really lively discussion addressing the role and impact of museums in enhancing the health of our visitors. And just to give you a snapshot of our hour together, we're going to be hearing from my colleague Tim, who is the chair of communications for EdCom, who is behind the scenes for us today. And he's going to give us an introduction into our technology, some additional information regarding communicating with us and using the platform. And then I'm going to turn things over to my colleague Brooke Evans, who's the president of MER, Museum Education Roundtable. And then we're going to dig right on in with our two featured presenters today. And I will be speaking to them, introducing them shortly, followed by later in the second half of the program, Q&A. Questions from all of you, and then we will be wrapping up our hour. So looking forward to the hour together, and I'd like to now turn things over to my colleague Tim.
Hello, everybody. My name is Tim Rue. I'm the communications chair for EdCom, and welcome again. As Sherry mentioned, we're going to be looking for some questions from all of you as we go through today. So I just want to give you some quick instructions in case you're not familiar with Google Hangouts. You will notice up in the top right of your screen there is a little set of 9 white boxes. They should look a little bit like that. And if you guys go ahead and click on that, you'll see the Q&A and Showcase buttons show up. And if you click on the Q&A, you'll find a place in order where you can enter questions, type them in. You'll also have the opportunity to hit +1 on other people's questions to move them higher in the queue so that our presenters know what you as an audience really care about and what you want to hear more about, and we'll try and focus on those questions. Also, if you'd like to participate yourself in the discussion, we're having a concurrent Twitter discussion on Museum Ed Chat, and I will pull up that so you guys can all see that as well. Here you go. So you can see Twitter hashtags and handles for both the hashtag Museum Ed Chat, which is where we're going to be talking about what we've got going on today, and you'll also be able to see handles of a few of the folks who are participating. One last thing I want to draw to your attention, if you go back to those 9 little white boxes, next to the Q&A, you will see a Showcase button. That'll pull up each of these websites that you see listed at the top of this intro page that you're seeing right now. So if you ever want to access any of those pages during the show, just go to the Showcase button, click on that, and you can access that. And then feel free to join us back in the Q&A so that we can hear what you've got on your mind. I'm going to turn that back over, and if you guys do have any questions related to a technical aspect, I'll be watching for those in the Q&A as well. We'll talk to you later.
Great. Thank you, Tim. That was really helpful. And again, if anyone has any questions during the time regarding the platform itself, or you want to post questions that we can watch out for, please do use that Q&A button. And then I'd like to ask my colleague, Brooke Evans, to speak to the Museum Education Roundtable, and as well as the Journal of Museum Education issue at large before we dig into some details regarding our 2 guest presenters and the articles that we circulated.
Great. Good afternoon, everyone. I would like to just start off by thanking Anthony and Sherry and EdCom for the opportunity to discuss the JME with you today. I'm very excited about this issue, not only because I'm the president of MER, but I had the opportunity to guest edit it with 2 wonderful and knowledgeable colleagues, Heather Johnson and Carol Krukoff. We wanted to focus on this topic because the three of us have seen personally and professionally the impact museums can make on health and wellness of our families and our communities. Museums are places of preservation and learning, but as Lois Silverman states in her book, The Social Work of Museums, museums also contribute to the self's pursuit of health in major ways, such as relaxation, introspection, promoting positive feelings, and raising public awareness on health-related issues. The measurable impact of these programs is an important part of this JME issue. As educators, we know that our programs affect positive change in participants, but we felt it was key to demonstrate that impact through a variety of evaluation methods, qualitative, quantitative, as well as personal reflections of participants in the articles. For example, in the Art in the Moment article out of the Art Institute of Chicago, Lewis Livingston talks about a program for people diagnosed with dementia and their care partners, and through the evaluation really noticed less isolation, heightened sense of mood, greater participation in social activities, and also all of this as a result of their evaluation studies. Through the different examples of evaluations, we had hoped to show how museums of all sizes can measure the impact of their work and then use that information to really validate what you're doing with your stakeholders and others. Two quick things I'd like to note about this issue. Health and wellness is an enormous topic, and we only covered a small portion of what's out there. We chose a diverse group of museums in terms of content, art, science, children's museums, and also audiences, for example, high school students, Alzheimer's patients, and medical professionals. But in our research, we learned about so many more programs. As AAM's 2013 Museums on Call report documented, at the time, there were about 50 programs, 50 states that had programs in 10 different healthcare areas. I also just want to emphasize the importance of partnerships. The institutions outlined in this journal are working with partners large and small to implement these programs with the audiences they're targeting. And I can speak personally to the work that I do with medical professionals would not be possible without a strong partner on the medical side. This is a person that can speak the language of their colleagues and can make a case, in this instance for very overworked and tired colleagues, to come to the museum for 2 hours instead of going home to their families. I want to thank the authors who made this issue possible and shared their rich perspectives and programs, and also to Cynthia Robinson, our editor-in-chief, who spun all these great stories together and worked closely with us to bring this issue to life. I'll end with a quote from one of our panelists, Andy Ackerman, that really inspired me. A museum can anchor community change when it functions as a trusted partner and catalyst. And I'll turn it back over to you, Sherry.
Great. Thank you so much, Brooke. I do think this is a topic that resonates across the spectrum, thinking about, as you mentioned, museums, large and small, varied collections, and really thinking about what the assets are that our museums bring to the table, and then the community partners with whom we can work with really closely to make a difference in our community. So the full issue was really great, and I'm really delighted that we have both Andy Ackerman and Lydia Zoff with us today to speak more in depth about their projects, more in depth about this topic, and providing some recommendations and things for others, our attendees, and those who are going to view later on YouTube, some takeaways and some great ideas. So why don't we get started? I just wanted to reiterate that we are actually being complimented by Twitter right now on #MuseumEdChat. So in addition to questions coming in from our attendees in the chat box, we're also monitoring the questions coming in on Twitter through that conversation, and we're very excited about this partnership and collaboration with #MuseumEdChat, that this conversation will be continuing later tonight between 8 and 9 p.m. So we did include some key questions that our presenters are going to be considering and answering as we go through, but let me start by introducing each of them before we get started. So I do want to start off with Andy Ackerman has served as Executive Director of the Children's Museum of Manhattan since 1990. And he began his career at the Exhibit Museum in Ann Arbor, Michigan, and then he came back to New York to be a director of the education at the Jewish Museum. He served 4 years as Director of the Arts in Education program of the New York State Council on the Arts. And from 1998 to 2000, he served as president of the Association of Children's Museums and as a member of the executive committee of the New York City Arts Coalition. Andy today is going to be speaking through the lens of his recent article in the JME June issue entitled Museums and Health, a case study of research and practices at the Children's Museum of Manhattan, as well as from his years of experience in the field. And also, Lydia Zoff has been working in community mental health for 10 years and has experience in vocational rehabilitation, workforce development, case management, trauma therapies, and holistic offerings. She is currently the program director for the Veterans Project at Thresholds in Chicago, overseeing the delivery of a variety of mental health services to veterans with severe mental illness. Lydia will be referencing the recent JME article, Healing and Empowering Veterans in a Botanic Garden, and the partnership between Thresholds and the Chicago Botanic Garden. So we're really excited. These are two really fantastic case studies, and I think we're going to dive right in if our panelists are ready. Fantastic. One of our first questions I wanted to actually pass over to you, Andy, which was thinking about reading through the article, so many assets that museums bring to the table with regard to how we can further enrich or educate the community about health and wellness. So I'm curious if you could speak to what does your museum in particular have that contributes to that dialogue, and also what might be barriers that other institutions tuning in or other things that they should be considering be?
Well, a major asset is our partnership with the National Institutes of Health and the local Department of Health. That provided the medical expertise that enabled us to go out to the community and really present a very detailed program. On the flip side, the fact that as a children's museum we are not a government agency was a major asset. There's so many people in the community, especially in the immigrant communities, who feel very threatened by even going to a hospital. One of our partners at Mount Sinai Hospital said, nobody wants to go to the hospital and everybody wants to go to the Children's Museum. That asset, coupled with the fact that we're such a trusted partner already in the community, and I advise people to start any project with a trusted partner, a long-term partner, enables us to do informal assessment before we even can create a research or program protocol. So those things together really make for the environment that enables a program to take root and then to grow. In terms of barriers, I think it's important around health that you have to really walk the walk. And that means having a healthy environment in the museum. It also means that you really can't take funding from certain types of corporations who produce unhealthy products. And that's difficult. When we created our health exhibit, we turned down significant funding from a food company because we deemed their product unhealthy. So you really have to walk the walk, and sometimes it's just not so easy. So that's what I would say the major assets and barriers.
I'd like to actually follow up with one aspect of the article that you speak to, the implications for museums as well. Could you maybe address a bit about that, as museums being those unique players in the community? Just talk a little further about that.
Sure. We're a common ground, and people want to come to the museum. Museums tend to be very respected education partners. Our assets include being great translators and using the arts in particular as a way to engender behavior change has proven to be very powerful. Surprise and memorable experiences from the research turned out to be the things that really stuck with participants, and museums do that really well, whether it's through a surprise piece of an exhibit or a surprise program. Those things tend to be memorable. We're also open to the public all the time, so you don't have to come by an appointment. Using a lot of those assets and pitching them to the public, and then pitching the fact to funders that the press is always welcome, so that we can really get across a large-scale message to the press that's more than just to our visitors. And that provides a very unique set of experiences. There's a pro and con also in the diversity of our audience. I mean, our audience really reflects the diversity of New York, which is fantastic, but that means the attitudes toward health among our visiting public is from A to Z. And therefore, you've got a real challenge in how you deal with all the cultural norms.
Great. Thank you so much, Andy, because I think that there's so many considerations when you think about the collections that we bring to the table, the relationships that are already in existence, and then the needs that happen. I know we'll talk a little bit further about research and identifying those needs through different needs assessment practices, but I wanted to turn things over to Lydia and ask you, Lydia, you know, I was, in reading the article, I was really excited to see that the relationship that began with the Chicago Botanic Garden actually seems to have begun with your interest in partnering with them and what you were looking for. So and that was, I believe, back in 2013. So I'm curious if you could speak to why might a local community organization seek to partner with a museum on these types of programming? And kind of what are you looking for and how do you find that right match?
Sure. Well, Andy had mentioned just a couple minutes ago that they found that no one wants to go to the hospital. They want to find different ways to promote health and wellness. And that's very similar to what we have heard from the veterans that we work with. We kept hearing over and over again about people who have been involved in the mental health treatment system for decades. And they wanted something different, something that ignited their soul and made them interested in the world around them. And I think that museums can really fill a lot of that need. Museums are super helpful because community organizations might want to partner with them to develop holistic offerings, things like the horticulture therapy or other artistic programming. We've also seen yoga and exercise programs being developed with museums. Educational purposes that's a great reason for community organizations to partner with museums as well. I think another way that we see individuals impacted is through social wellness. You know, you're able to get a group of people together for a common goal or a common interest, and exercising those social muscles really impacts somebody's wellness. And then I think lastly, especially for community organizations that are working with kids or parents, anytime that there's an opportunity to involve a family or get kids involved, I think that can really impact the whole family unit in a really powerful way by providing a structure and an environment for people to interact with each other and build relationships.
That's really great. And I know that your relationship and partnership with the Botanic Garden in Chicago has actually continues to grow since then, based on a lot of feedback that you've received as well from participants as well as staff. So that I think is really great. It seems like you have a really great relationship and communication between staff, participants on both ends.
Yeah, we certainly do. And I think when community organizations and museums can partner together, a huge part of the success comes from that relational piece, from the team at the museum and the team at the organization being able to work together, plan the programming together, developing the goals and the expectations, and both parties taking a lot of responsibility for what's going to happen and what results they want to see. And that, I think, again, that relational piece is a really big deal because community organizations they're dealing with heartbeats, with human lives. And so for a museum to partner on that same level, it really has a wonderful impact.
Great. Thank you so much. I think, you know, thinking about the partnership opportunities, identifying similar goals, intended outcomes, and understanding the needs and what both organizations bring to the table it's a really wonderful dance that happens, and a lot of coordination and a lot of effort goes into it. And I'd like to ask Andy, I'd like to shift things over to you for a moment to think about when you are, and you can use your example, specifically the project about thinking about childhood obesity from your work with NIH. I'm curious, what community partners do you think about in that project or in others that best inform or complement your goals? What do you look for? How do you go through that process?
Well, choosing community partners, we want partners who represent a particular community. So identifying who we want to reach, who's the target audience. But when I look for a community partner, I also like to apply the multiplier effect. So does a community partner have other partners so we can multiply the impact through them? Because we just don't have enough time to scale everything ourselves. So how can we work through a community partner, including a city agency or a government agency, so that the impact inherently gets multiplied? As we went through the process with the NIH and got some pro bono assistance from Morgan Stanley, we established a whole set of webinars so that we could communicate with people across the country. I mentioned to you we did one with the Navajo Nation last week, and we've done it with libraries and museums across the country. So to us, the multiplier effect has become really important. But we do start with really trusted partners, and we have to go into the community and listen for a long time. Because community partners, particularly in low-income communities, they've been burned so many times by people coming in and just doing their thing and leaving. One thing that we've learned that I think is counterintuitive for museums, especially those of us from an academic background, is that knowledge in and of itself does not change behavior. If knowledge changed behavior, no one would smoke cigarettes. So the affective or emotional part of behavior change is as or more critical than knowledge. And what we were talking about before in terms of the social and the emotional context and giving people voice turns out to be more important than dispensing information. And once we understood that, we opened up a whole new realm of conversation with the people who we were really trying to help, whether it was at the museum or in community settings. It must be a two-way street of communication. And in the article, I talked about how we had to change course on a whole number of things as people revealed to us things we had never thought of about economic diversity and thinking, why are you giving us skim milk? We want whole milk like rich people. Well, that never came out in the formal research, but it came out in a trusted relationship as we were doing an art project. So you need a variety of different approaches, and choosing a partner who can accommodate that turns out to be a critical set of decisions.
That's great, and a lot of pieces there that I think are really important for museums and community partners to think about when they're identifying who's the right fit, from audience to time to dissemination of information as well. I know, Andy, you all from your project now have expanded even beyond into many other units. Is that correct? Could you speak to kind of what has happened since the kind of more recent?
So it was sequential. We started out with producing a curriculum at the NIH that the government and the White House published, creating an exhibit here. Then we created a professional development module locally that we've used also nationally. Then we created a website, which created a community, mostly among professionals, who could talk to each other about some of the lessons and some of the experiences. So all of that continues to build upon one another, and as a result of all of that, now some funding sources have come to us in order to design classrooms, for example, participate in a CDC grant. Now really, to be honest, at a point where we're not quite sure how we take the scaling further. So there has to be a period now of self-reflection and assessment and kind of holding off some of the additional partnerships until we can really get our arms around it. And the last component is an enormous amount of requests for us to formally enter the realm of emotional and mental health because of the condition of children under stress in our society.
Great. You know, what you just mentioned makes me think a lot, Lydia. I wanted to turn to you. In reading through the article and in talking with you as well, the relationship, this moment of self-reflection, I think is really interesting. And could you speak to, you know, how when you are looking from your perspective to the museum, looking at how you're identifying the museum's goals and how what those connections are. I know also, could you speak a little bit in that moment about that transition, the decision to continue to work with the Botanic Garden as well, because I know that work continues.
Sure. So I think what me as a community provider would look for in a museum is similar to what Andy was speaking to. Again, I can't communicate how important it is to really build a relationship. So being able to call the other person who's at the museum. I know the partners that I work with at the Botanic Garden, if they were to call me on my cell phone and they needed something, I got them, whatever they need. And that really starts from the beginning. It's really helpful for museums to understand that the development of programs like this can take a long time. So it's really helpful to have a community partner a museum that understands that. Sometimes there are, museums or other places that have an offering that they want to do right away. And I think being able to go through the program and really tailor it to the particular community program that you're working with has its benefits to make sure that it is the right fit for the population that's being served. I think it's also really important when that providers are understanding the motivation and values of the museum. What is their mission statement? What do they see in terms of how they're aligned in the community? Or on the other side, is this something that they are looking for media coverage, or they want some public recognition? So really understanding what their motivation is helpful for us. I also find it helpful to get a good understanding of what the museum's motives are and what's their commitment to social justice. As community providers who work with families and with individuals, we're interested in providing services, and we're also interested in advocating on local and state and national levels, and impacting policy and impacting change. So being able to understand how the museum is also doing that helps us find a really common ground. I think it's also important to understand what need the museum would be able to fill for the program or for the community provider that you're working with. It's important to understand what kind of barriers might get in the way of developing a program with the museum. For example, accessibility or funding. And then, like Andy talked about too, I am also thinking about scaling. Would we be able to develop a partnership, or would we be able to develop a partnership or a program that can be scaled across populations and communities? And can we measure the success and measure the impact so that a greater group of people can benefit from it? And then lastly, I'm looking for museums that can help make art and culture accessible to those that we serve.
Great. And I actually had I wanted to actually follow up on what Lydia just mentioned. So I just want to make sure, oh, Lydia, I think you're connected still. Okay, great. So I wanted to actually pitch the next question over to you, Lydia, based on what you're talking about with collaboration. And could you speak to how you might best collaborate on both the development and implementation of programming? Could you talk us through, Lydia, on that relationship specific to your example and others that might inform your answer?
Yeah, Sherry, can you repeat that? I was just fixing my microphone and headset.
Sure.
I'm sorry.
Absolutely. I had a feeling. So I just wanted to continue the conversation. You were talking a lot about the collaboration piece, and I'm curious if you could take us through the process of collaborating from the development and implementation, just maybe some highlights on how that worked, and yeah, either for this project as well as others.
Sure. So for this project in particular, I had thought about the Botanic Garden, and I thought that we might be able to partner with them after I had heard from our veterans that they want something new and they want something different. And so I contacted somebody that I had known in a previous role. Her name is Barb at the Garden, and I let her know that I wanted to see if we would be able to possibly develop a program or see if we could do something to impact the lives of the folks that we worked with. And her and I threw some ideas back and forth on the phone and decided that one way that you can really develop a good program and reach members in your community is to get the input and to get the buy-in from the staff and the teams that are involved in the partnership. So from there, a couple weeks after we had our first conversation, I brought my entire team of about 20-25 staff up to the Botanic Garden, and Barb and her team at the garden planned a day of activities for us, very similar to what our clients might experience. We really wanted our staff to get an idea of what it would be like if our folks were able to come up there for services. And we went on a tour of the garden. We did several horticulture therapy activities. We had time to process what the experience was like, and there was an opportunity for staff to provide input. And at the end of the day, there was a consensus across the board that people felt good. They felt that their mood had shifted at the end of the day. They felt that they were able to connect with each other and with the surroundings that were there. And so it was a really easy answer, I guess, from there that if this is having such an impact on staff, we need to be able to do it with our clients. And that was in July, and so we spent the next 6 months meeting, and through those meetings we tailored a program that we thought would be best suited for the folks that we work with. And it was done in complete collaboration. We met with the horticulture staff at the Botanic Garden, and we discussed when we would want to bring our clients up there, how long we would want them to be up there, what sorts of things they wanted to get out of it. They talked to us about different kinds of activities that they could do with our group and different conversations they could have. And we picked and chose and put together a curriculum that we thought would be appropriate for our programming. And then behind the scenes, on the community partner end, it was up to us to also figure out the logistics, how we were going to get people there, how we were going to get people excited about the programming. And I think another piece that was really important is community partners still incur costs related to programming like this. So being able to have some short-term and long-term funding goals to figure out how to continue to support this program was really an important conversation for us to have. And one other thing I want to add is when we started our programming the following spring, it was in April, we had discussions in between every single session to troubleshoot what went really well, what might need to be fixed and replaced or changed up. And so being able to be flexible and resilient was really helpful in making sure that we were providing an experience that was meaningful.
That's great. Thank you, Lydia. I'm actually just noticed as you were talking as well, we had a question come in, which I think you actually addressed, which is wonderful. And that was about getting buy-in from staff. So it sounds like you really introduced them at the very beginning. You included them in the planning phase, and you also talked about some of the challenges as well. We might kind of get back into that shortly, but I think that was really great. I'd like to ask Andy, if you could. There's a really amazing amount of information that you provided in the article that was about the measuring impact of the program and what considerations you had, the process, and I'd love it if you would be able to talk more about that in terms of measuring impact from education, therapeutic, behavioral, all sorts of areas.
Sure. We conducted, I think, a half a dozen very formal research studies. The first was a 3-year study. What was kind of funny is that after the first year of the study, the research was so good that the NIH started to move to publish the research and the curriculum before we were even finished. And that's because they hadn't seen such type of behavioral change. I think museums, we have to be very clear-headed about what type of change we're really talking about. The research was very intensive work, really behavior change in small, focused groups. That's the type of intense, quality-based education. It's very different than in the museum where we have a goal of creating conversation. There's a different measuring of that because it's different impact. The lowest level, as far as I'm concerned, is awareness. And we can measure all 3 of those. We have measured all 3 of those. They're different tools. but you're not going to get the same results from a casual visitor to a museum as to somebody who's taking part of an intensive education program. So you have to adjust both your goals, expectations, and your research protocol to fit. But in all of those things, what kept coming out during the research, both formal and informal, was this relationship between the trust relationship and what's revealed in that relationship that doesn't get revealed in the formal research where they don't know the researchers even though they're on site all of the time. A lot of traditional stuff in pre-testing and post-testing, but when a Hunter College School of Health did the evaluation of the exhibit, they also tested how many calories kids were burning in the museum, in the health exhibit, which turned out to be a revelation because the kids were burning so many calories on all of the activities. The one other thing I'll say is that you have to have a little bit of faith that you can take the research and transfer that knowledge to other types of programs without conducting additional research. The research is very expensive and very time-consuming. And at a certain point, you can't provide qualitative and quantitative metrics for every program that you do, otherwise you won't be delivering services. So we now have faith that we can take similar methodologies and use that quite effectively in other domains without conducting the same level of research.
I think that is such an amazing point to make, that the data that we're collecting, the research that you're collecting, or other projects, how is that information that you're learning transferable into other areas and can help better those experiences, whether it's for the participant or even in the experience partnering with another organization. So I think that that's really valuable message. Lydia, I'd love to get your thoughts if you have additional comments regarding the evaluation and the measuring of impact. And then Brooke, I'd like to also, after Lydia, if you have thoughts on that as well. But just before we do that, I did want to mention that for those of you who have questions, we do have the Q&A section. So I am watching that as we are going through the questions that we had previously identified. So please do use that. But Lydia, could you speak now to measuring impact?
Sure. So my response is similar to Andy's. I also think it's really important to have evaluation in place because, you know, we have great ideas, but without sort of like the concrete evidence that this is having an impact on folks, might not mean a lot to some people. And so we have done the same thing by doing pre and post surveys. Working in human services, I know that a lot of different organizations do ongoing service planning for the clients that they work with. So being able to identify goals with individual clients and seeing if those goals and those needs are being met through these kinds of programs and services is really helpful. There are different quantitative quality of life screenings and indicators that can measure wellness in a number of different ways. I think anecdotal evidence is certainly helpful if you're writing narrative about the experience. And then lastly, I can speak to mental health in particular. We're able to assess symptoms and measure symptoms. There are a number of different numerical indicators and screenings that we use to see where somebody is at in terms of their mental health. We also can do a thorough review of case notes and service notes to see if there's any patterns or any progress that emerges through that. And it's also been helpful to do a facilitated focus group toward the end of each session in order to see what kind of feedback participants had and what sort of ideas they had. And then lastly, I think that attendance is also a really good way to measure the impact or to measure the success. For us, the attendance at the programming with the Botanic Garden was not mandatory. People chose to travel, oftentimes very far, up to 2 hours, to attend the retreats. And I can't help but think that a lot of people wouldn't do that unless they were getting something out of it.
Great. And Brooke, any additional comments that you'd like to make about the specific aspect, the measuring the impact?
Sure. Yeah, I would agree with everything that Lydia and Andy have mentioned. I think I would just add to not be afraid of evaluation. I think sometimes it can seem a little intimidating as to kind of where to start. And I think your starting place is really talking to your partner and finding out what goals they want, what outcomes. For the medical professionals that I work with, talking with them about what's effective in terms of what's going to convince the skeptics in the medical profession about why this is useful in terms of either qualitative or quantitative data. I would also add that you can do some simple feedback options. I think Lydia kind of touched upon this a little bit, but we ask just 3 very open-ended questions at the end of our sessions with the medical doctors, and through the answers to those questions we get some really interesting feedback in terms of what to change, what was surprising, what was helpful, what to keep in mind for future sessions. And then, you know, we've documented that over the course of almost 6 years now, so it's only 3 questions, but over 6 years it really adds to a lot of feedback. The third thing I just mention is thinking about both long-term and short-term studies too, and how that might be effective and helpful to your goals and your outcomes. For us, working with medical professionals, our short-term outcomes are fantastic. We haven't really had a chance to test the long-term impact of these programs, and so that's something that we're getting questions on now, and we need to start thinking about. And then just to put in another plug for the JME, there was recently a whole issue devoted to evaluation with some very practical tools and tips on how to start evaluation studies. So I would encourage people to look at that too for ways on how to start the process.
Great. And while I know that we have time for Q&A in a short bit, but I did see there was a question did come up that's specific to what we're talking about right now, which is what about some pre-evaluations about expectations and some needs assessment ahead of time, which I know that I know Andy in particular. I know you can actually address that. I see you nodding. So can I ask you to address that?
Sure, we have learned an awful lot. And before I get to specific about how you do it, understanding the perceptions and the misperceptions among the target audience is essential. And we only learn that through the process. So many things emerge, but we said we had no idea people were thinking about that in terms of health. As a result of that, we transferred that knowledge to a current research project with Johns Hopkins University about language acquisition among low-income families to understand what their misconceptions were so we could address the actual needs instead of us determining what the needs were. And that's the general part. In needs assessment needs to understand what the audience needs, not what you think the audience needs. Because you're coming at it from a very different point of view from working in a museum or a university. So the needs assessment has to really proceed multifaceted, and oftentimes it takes frustratingly long, but it's worth it. It's worth the year or two sometimes that we put into a needs assessment so we can have conversations, engage the community formally, develop a feedback loop, which turns out to be really important, and not just at the beginning, but moving on all the time, because some of those misperceptions or really feelings of economic stigmatization or racism, they take a long time to come out. And until you get those things out, you really don't know how to design your program so that you can address what we think are the deep core needs of a community.
Great. That was really useful and very helpful to hear. And I'm actually thinking one of our final big questions that we wanted to talk about has to do with funding. And as you even mentioned, these needs assessments sometimes start a year or so ahead of time before you actually get into the development of the program or even the implementation. So Andy, since you just mentioned that, can I ask you to speak to how the programs are funded? I know you spoke a little bit about the current project, but even others. Do you find that typically the museum partner or the partnering organization or both are seeking funding for the project?
We do it in partnership, but the truth is a lot of these get funded by the museum's initiative first. And you know, an old rule of fundraising, go to the people closest to you. Maybe it's a board member or a foundation you know really well. In our case, it was a personal foundation and IMLS. where we felt we could submit a couple of proposals where IMLS in particular would take a risk, because it was well defined within our strategic plan. There are times, many times, when the partners are in no position to seek funding. And you have to be a realist about that. The museum world is always short on funds, but it is nothing compared to the social service world. I mean, those guys are so strapped to provide the daily services to people in need. They are really running nickel to nickel. So we have done much of the fundraising, but a lot of it's been done in partnership with community-based organizations who write support letters, who agree to put in their own resources, and all of the foundations, particularly, are looking for that level and degree of support. And once it's established and a reputation is garnered, then sometimes you'll get people coming to you to either hire you, kind of a nice earned income professional development, or certain types of contracts where people need to be fulfilled, and you happen to have the expertise because of the long relationships.
Great. I know that both Lydia and Brooke have responses to this question as well. So can I just ask you both to take a few moments to respond to that? Maybe Brooke, do you want to start?
Sure. So I'm sorry, I was actually going to respond to the previous question. I can respond to this one too. So for the programs that I'm working in, which are primarily medical programs, I would say it's about 50-50. So we do have a donor that's very interested in this type of work and funding particular programs with a particular institution. So that connection, that personal connection that she has, but it is a barrier to our programs in some instances because a lot of, not the funder, I should clarify, but having the hospitals pay for the program because they just don't have the funding. They're large institutions, but as Andy said, large institutions that are strapped. So that has been a barrier to some people participating with us. So it's a challenge.
Right. Great. Lydia, thoughts on this?
Yeah, I think it's really important that funding is discussed as early as possible. And, everyone was right when we're saying that community partners are really strapped for cash. A lot of community organizations are receiving funding or reimbursement from local, state, or national entities and institutions. And what we see is across the board, funding for programming like this and funding for human services is being cut by the millions. And we also see that for services that are being reimbursed, the reimbursement rates aren't increasing, even though the cost of doing business is increasing. And so being able to have a common understanding about barriers in funding is really important. In our project, from the beginning, we knew that the Botanic Garden had received funding from the state that was very specific to provide programming for veterans. And that worked out really well because that funding was able to support all of the programming that we wanted to do that very first year. And going into the second year, we knew well in advance that that same funding stream wasn't going to be available. And the garden picked up they were able to support a significant amount of what the final cost was. And then we were able to identify donors and funders who were interested in supporting an initiative like this. Just like Andy had suggested, being able to approach an existing funder or somebody who you've worked with before and asking for a special project has been really helpful. It's also been helpful to co-write grants with the Botanic Garden. And by being able to showcase the work that we had done, since we already had a year under our belt, we were able to get a grant to cover some of the holistic therapies that we provide, including the programming at the Botanic Garden. So there's definitely ways for it to be done. And I see that a lot of funders and foundations are interested in funding projects that are new and unique and that are aligned with education and art and culture. And so it's a great way to sort of capitalize on what a lot of funders are interested in and also make sure that community organizations and the clients that they serve can really be a part of that as well.
Sherry,
Great.
can I just jump in for just one additional thought about the impact of evaluation in funding too, and really being able to take that data to your funders, whether it's qualitative or quantitative, can help secure those grants as well.
Great, thank you for that, Brooke. So I've been integrating some of the questions that have been coming in through the Q&A as I've just kind of seen them pop up, and Brooke, you might be able to see some of those as well. One of the questions that seems to really be resonating with folks who are attending, Lydia, the question's actually for you. Thinking about the challenges that you and your staff might have faced in initiating your program, especially thinking about, you mentioned as a social service agency and barriers or challenges. Do you think you could speak to that in just a few moments?
Yes. So in terms of getting staff buy-in, honestly, the first very practical challenge that we had is we were visiting the Botanic Garden in the middle of July where it was 100 degrees outside, and my staff was like, I do not want to be outside. There is no way I'm doing this. And so that was a very big hurdle is, if you have staff that are physically uncomfortable in an environment, how do you sell this to them if they don't feel good? So being able to mitigate that was important, and actually what we were able to do was we were able to move some of the activities into an air-conditioned room, which was really helpful. I think getting staff, being able to provide a similar experience to staff so that they can understand what they feel like and what they're actually doing is beneficial. I think that that's helpful. I think it's also really important to get staff input when the programming is being developed. The staff that are going to be bringing clients there, those are the ones that are on the ground doing this work every single day, and they have a really good eye on what's working and what's not. So for them to be able to have input about the programming is key. I think the other thing that we see is sometimes when you add additional programming like this, staff might see it as, oh, that's another thing that I have to do on top of my already really busy day. And I think that that's an opportunity where community organizations can try to get buy-in from their top, so from their directors and the people at their organization that are making decisions. So if those leaders are able to see the value in programming like this, they can make changes to workloads and scheduling and provide the infrastructure that's needed so that staff can carry out this programming without it feeling like it's a big burden. And then finally, I think that the piece that's really important around staff buy-in is if this is something that the clients and the families like, having an opportunity for them to give feedback to staff, talking about the impact that it's had on their health and wellness, I think that that might be one of the biggest motivators for staff. In the helping profession, staff are really motivated by the wellness and by the impact that they see with the clients that they're working with. So if they can see that this kind of programming is working, they're going to want to do more of it, and they're going to want to get other clients involved as well.
Mm-hmm. And I just wanted to just quickly add, and Lydia and Andy, I'm not sure about your programs, but the medical programs that I do, a lot of them are voluntary for the participants. So thinking about that question of whether you want your program to be voluntary or required, I think it's wonderful and we get a great turnout for the people that come. But I think there can also be an argument made that those are the people that already have buy-in. And it would be great to get those skeptics to come to the museum as well. So thinking about that type of stipulation for your program might be important too.
Great. Well, thank you all so much. We are approaching the top of the hour. Time certainly flies. And I would really like to just ask Andy and Lydia if you could share just in a few moments some takeaways for our those who are attending. And then we will be wrapping up with a survey and some other final remarks from myself and Brooke. So maybe Andy?
I would say never be shy about the power of a museum. We're on the front lines. We see hundreds of thousands of people a year, and for the medical profession, we can provide really extraordinary insights. We saw the obesity epidemic among children starting in the late 80s before it was on the national agenda, because we saw kids walking into the museum and said, oh my God, what's going on? That's a power and an asset that we have that predates any type of statistical study. So my advice is never underestimate the power of our audience and who we are on the ground every day.
And Lydia?
So I have three small comments. The first is when there's programming being developed between museums and community partners, food cannot be underestimated. And I mean this very sincerely. I've seen that being able to provide a meal or to provide refreshments really does have an impact on the whole experience. I think it's a gesture of hospitality and service. It helps to build a sense of community. I mean, people eat at dining tables. And then I think most importantly, being able to share a meal with clients or with other, community organizations helps to level the playing field between professionals and participants. Second, I think it's really cool when I see museums involved in community networks and affinity groups that service providers might be involved with. So if there's a particular population or a particular initiative that your museum is interested in, see if there's a community network or an affinity group that can pull you in and help you outreach to community partners that might want to develop programming with you. And then lastly, I think that programs like this are really important. A lot of community providers like me, when we start working with individuals and families, we're usually seeing them when they're the most vulnerable, when they are just at their worst, and they come to us to get their most basic survival needs met. Things like shelter and food, establishing income, those sorts of things. And that's what a lot of us do. And it means a lot to be able to be involved in someone's life at that point. But what's really magical is when somebody has their basic needs met and then you're able to provide an opportunity where that person can thrive. And offerings like this, partnering with museums, partnering with gardens, partnering with some things that help people ignite their spirits and develop interests and have new hobbies, those are the sorts of things that help people thrive. And any opportunity that we can take to impact that, I think really makes a change in our communities.
Great. Thank you so much. I know that we are coming, again, as I mentioned, to the top of our hour. So I wanted to ask Brooke, you had a few final remarks, and then I will close out our program. Brooke.
Yeah, so just quick things, and a thank you to all the participants and the panelists. This has been a great discussion. I would encourage folks to check out the JME 40 blog. This month's blog is by Heather Johnson, who is one of the guest editors for this issue, and she has a really powerful reflection on her husband and her family's recent medical experience and how museums have really helped in that. And then also, if you're interested in continuing the conversation, we developed a reader guide with a series of discussion questions around this issue, so that can help with you with generating a discussion. And then just put in a plug for our next issue, which is out online now and completely different. It's called New Intersections for History, focusing on history museums by Mary Ruth Leftwich is our guest editor. So if you want to completely change topics, you can do that.
Fantastic. And just my final notes are, of course, a very big thank you to Andy, Lydia, and Brooke for your time today and your sharing your experience and some really great information. I've been following a little bit on Twitter with the hashtag MuseumEdChat, and a lot of really great takeaways from our conversation today. So I want to thank you very, very much for that and for sharing your experiences. And I do want to note that we do have an evaluation for the program today. My colleague Tim, I believe, will probably show that. There's a link that you can follow, as well as it's listed in our showcase, if you see that on the left-hand side of your screen. We also will be having this broadcast up on YouTube. So we will be sending that link out to all attendees as well. I too wanted to make a brief nod to our upcoming EdCom program that is our next Google Hangout. That will be on August 18th at 2 p.m. It's the next in this series of our third Thursday Google Hangouts. And then I also wanted to mention again the Museum Ed chat that's going to be continuing this dialogue at 8 p.m. So again, thank you to our presenters. Thank you so much to MUR, Museum Education Roundtable, for partnering on this, and to the hashtag Museum Ed Chat for partnering on this. And of course, a big thank you to my colleagues at EdCom, Tim, who has participated in this on the back end, as well as the rest of the steering committee, and to AAM for making this all possible with a lot of behind-the-scenes organization. So on behalf of all of us, to our attendees, until the next time, and I thank you all, and I hope you have a really wonderful rest of the day.
Thank you.
Thank you.